Have you ever stood in the bathroom waiting and waiting, but the urine just wouldn't start flowing and you quietly told yourself, I guess I'm just getting old? Have you found yourself waking up 2 or 3 times every night just to urinate, thinking that this is simply the price you pay for aging? Or deeper still, have you felt a silent fear creeping in? Is this just normal aging, or is my prostate developing a problem that I'm not ready to face yet? Many men believe that a weak urine stream, nighttime urination, or the feeling of not emptying the bladder completely are inevitable parts of getting older. But as a urologist, I can tell you something that surprises many patients. Not every change in urination is just aging, and getting older does not automatically mean your prostate must enlarge. There are subtle warning signs that, if ignored, can cause you to miss the chance for early intervention. But if you understand them correctly, you can significantly slow down problems that many men assume are unavoidable. In this video, I will help you clearly distinguish between normal age-related changes and signs that your prostate may be quietly enlarging day by day. More importantly, you'll understand why two men of the same age can have completely different experiences when it comes to urination. If you find this information helpful, please subscribe to the channel so you don't miss future videos on men's health, topics that very few people are willing to speak about honestly. And while watching, if you feel this video helps you better understand your own body, leave a comment with the number 1. If you feel it doesn't match your experience, leave a 0. I read and listened to every comment. Now, let's begin with the most important question of all. Why is it so easy to confuse normal aging with prostate enlargement? Most men, as they move into middle age, begin to notice small changes when they urinate. The stream isn't as strong as it used to be. They have to stand and wait for a few seconds. Sometimes there's a lingering feeling that the bladder isn't completely empty, and the most natural reaction is self-reassurance. It's probably just age. But this very thought is the reason so many men miss the most critical window for recognizing a real problem. Normal aging can slow down the bladder muscle and make the urge to urinate less immediate than it was in youth. But aging alone does not cause the urethra to gradually narrow over time. When the prostate enlarges, it grows in a way that surrounds the urethra like a tightening ring slowly squeezing it. At first, the pressure is so mild it's barely noticeable, but year after year that pressure increases and your body is forced to adapt. The danger lies here. Both processes happen at the same time. And if you don't clearly understand the difference, you'll blame everything on aging, while your prostate continues to enlarge quietly, day by day. There's a very important question you should ask yourself at this point. If this were truly just aging, why are some men your age still urinating normally while you're not? And what if the real cause isn't age at all, but a process you could significantly slow down if you recognize it early enough? One of the biggest misconceptions I hear from patients is this: Doctor, my testosterone is getting lower, so why is my prostate still getting bigger? It sounds logical on the surface, but the human body doesn't work that simply. Testosterone is only the starting point of the story, not the whole explanation. When testosterone enters the prostate, it is converted into a more potent form called DHT. This substance binds very tightly to prostate tissue and stimulates cell growth. Here's the paradox. Even as testosterone levels decline with age, DHT levels inside the prostate can remain high enough to continue driving enlargement. And this is the point many people miss. Once the prostate has begun to overgrow, it no longer needs high hormone levels to keep expanding. It shifts into a kind of self-sustaining mode, where inflammation and internal growth factors, not hormones alone, become the main forces keeping the process alive. This leads to a concerning realization. If you blame everything on hormones and aging, you'll overlook the other factors that are quietly causing your prostate to grow year after year. And those factors, unlike your age, are exactly where you still have some control. Most men think inflammation has to mean pain, fever, or obvious discomfort. But inflammation of the prostate often develops in a completely different way. It is quiet, long-lasting, and produces almost no clear warning signs for many years. You continue living your life normally, except that urination gradually becomes more inconvenient. When inflammation occurs in the prostate, immune cells release chemical mediators that cause prostate tissue to grow faster than normal. This newly formed tissue requires more oxygen, yet it often doesn't receive an adequate supply. The resulting lack of oxygen creates oxidative stress, and that stress, in turn, triggers even more inflammation. A vicious cycle forms entirely without your awareness. Here's the sobering reality. Many men only discover this cycle when their urine stream has become noticeably weak, or when they begin waking up multiple times each night to urinate. But by that point, the prostate has already been undergoing changes for many years. So the real question is this: if inflammation doesn't cause pain, how would you know it's there? And how many other subtle signals has your body been sending? Signals that no one has ever taken the time to explain to you? Many men focus entirely on the prostate and forget one crucial truth. The prostate does not exist independently from the rest of the body. It responds directly to the metabolic environment you create every single day. An expanding waistline, unstable blood sugar, increasing visceral fat, all of these send inflammatory signals throughout the body, including to the prostate. When the body enters a state of metabolic dysfunction, the sympathetic nervous system becomes more highly stimulated. This increases smooth muscle tone around the bladder neck and the prostate, making an already narrowed urinary channel even harder to open. At this point, the prostate isn't just larger, it's also tense. And here's the critical warning where you need to pause and reflect. Many men try to treat urinary symptoms while ignoring the root causes: lifestyle, weight, and blood sugar control. When that happens, every intervention is like wiping water off the floor while the faucet is still running. Once you begin to understand that every centimeter of waistline may be directly connected to your urine flow, you'll see this issue in a completely different light. And that's when we need to talk about something simple, but remarkably powerful: movement. Many people believe that improving prostate health requires intense workouts or spending hours in the gym, but real-world evidence shows the opposite. The body doesn't need more, it needs enough, and it needs consistency. Even gentle daily walking can create meaningful changes over time. Movement helps reduce systemic inflammation, improves insulin sensitivity, and calms the sympathetic nervous system. When these factors are better regulated, the prostate is no longer trapped in a state of constant stimulation. Pressure on the urinary tract gradually decreases, and the urine stream becomes more stable. What matters most is this: these results don't appear after a week or even a month. This is biological compound interest, building quietly over time. And because the progress is slow, many people give up too early. Before we move to the final part, ask yourself one very honest question. If making a few small daily changes could help you avoid major interventions later on, would you be willing to start sooner rather than later? If you've made it this far, you've probably realized something important. Not every change in urination is just aging, and prostate enlargement is not something you're powerless against. The male body is always sending signals. It's just that for many years, we were never taught how to listen to them correctly. The prostate doesn't enlarge overnight. It grows gradually, responding to inflammation, metabolic changes, and habits repeated day after day. And the most unfortunate part isn't that the prostate gets bigger. It's when men accept it as fate and stop asking questions. When you clearly understand the difference between normal aging and prostate enlargement, you hold the greatest advantage of all: the opportunity for early intervention. The earlier you act, the gentler the options. The later you wait, the more complex those interventions become. If this video helps you see your body more clearly, please subscribe to continue these honest, in-depth conversations about men's health. Conversations that few places are willing to have. And before we end, I want to ask you one question. Are you thinking more about your age, or are you starting to think more seriously about how you take care of yourself? Leave a comment and let me know, because the next video will go straight into the warning signs you should no longer ignore.